Mainly, there are two types of joint disorders. One is degenerative joint disorders, and second is inflammatory joint diseases. The chronology of the pathophysiology changes in both the types. Means in the degenerative joint disorders, initially degeneration of the cartilage or the synovial membrane or the soft tissues happens, and then the inflammation is followed by that. Whereas in inflammatory conditions, initially inflammation takes place, and it is then followed by the degenerative changes of the joints. When we talk about the treatment, the major change in both of these cases is the chronology again. In the degenerative cases, first we have to focus more on the nourishment of the joint and then the inflammatory part. Whereas in inflammatory conditions, the major focus has to be on taking care of the inflammation. What is inflammation exactly? Inflammation is nothing but the increased heat of the particular area. When we are talking about the joints, it is about the joints and its surrounding tendons, muscles, as well as the soft tissues of the joint. And when the heat is increased, the overall elasticity of the muscles and the tendons will be hampered. At the same time, you will find micro wounds in the inner lining of the synovial membrane. So that is how when it is rubbed, you will see the pain in the joints because of the excessive toxins, and the soft tissues and the connective tissues are inflamed. Whenever it is stretched too much, you will get the pain. So when we talk about these inflammatory changes, these factors exactly hampers the overall joint movements and causes a lot of pain and the stiffness in the joints. Initially, let us talk about how to take care of the inflammation. So Ayurveda looks at it in two different diseases. One is Sandhigata Vata, that is degenerative joint disorders, and second is Vatarakta or Aamvata, which is inflammatory joint diseases. Now, when we talk about the inflammatory joint diseases, Rakta Dhatu, that is blood, vitiated blood, is an important culprit as per Ayurveda. So that is why we have to take care of the quality of the blood. The toxins which has increased in the bloodstream has to be taken care. For that, there are importantly two important treatment has to be done. One is phlebotomy, that is Raktamokshana. That is, we have to remove certain amount of blood from your bloodstream. Before that, there are certain processes that we have to do the Abhyanga as well, and that is massage and steam or the various hot fermentation treatments has to be done. And then after that, we have to remove the blood from your blood vessels. This is maximum 350 ml of the blood is removed at a time, and which can be done only in once in a 6 months as per Ayurvedic rules. And as per the affected joint, we can do this locally. That is, blood can be removed just from one part of the joint if the knee joint is affected. So we can choose the nearby vein and we can remove the blood from that area. Or if multiple joints are involved, then in that case we have to remove the blood from either right cuboidal vein or the left cuboidal vein, that is in the middle of the upper limb. So once we remove the toxins directly by doing the bloodletting, so it is easier to deal with the other toxins of the body. And then the next step is to do the entire detoxification of the body. In this case, we have to do the Abhyanga, that is oil massage with the medicated oils, which are again having the anti-inflammatory properties, which helps to calm down the inflammation. And then we have to do the various fermentation treatments, in which the most importantly, dhara. Dhara means bathing a patient with certain decoctions or the medicated milk. Dhara, that is bathing by the medicated milk, has a lot of importance as an anti-inflammatory treatment of the joint disorders. Because of this, the stiffness comes down and the inflammation goes down. And then after that, we have to do the proper detoxification with the help of the Virechana. That is, we have to do the purgation, through which we do remove the excess amount of biopigments of our body, as well as the toxins which are there in the lower part of the gut are removed, which is also known as Aamvaman Chikitsa, which nourishes the Vata, which regulates the Vata, and because of that, when the nervous system is involved, which is causing the pain, will be taken care. Once this part is done, then we have to do the major part, which is common for the both degenerative as well as inflammatory joint diseases, that is Basti. And Basti is again of two types. One is nourishing Basti, that is lubricating Basti, and second is of detoxifying Basti, and it has to be done in combination. Basti is nothing but the medicated enema. We have to insert the medicines through the anal route. When we do the oil enema or the ghee enema, that nourishes or lubricates the system, and which helps us to do the detoxification Basti on the next day. The detoxification Basti is called as Niroha Basti. In this Niroha Basti, we have to use the decoctions of the various herbs or medicated milk with the herbs are used for the cleansing of the gut. So these two enemas are done in combination for the numbers of minimum 8 days to up to 30 days continuously, depending on the severity of the joint disorder. Because these medicated milk enema does contain milk as well as the ghee, and that stimulates the bone marrow to produce the good cells of the blood, as well as it also helps us to produce the good bone cells. So this is how the Basti, which is also called as Tikta Kshira Basti in Ayurveda, is helpful in taking care of the inflammatory joint disorders. Now, once we do these detoxification processes like Raktamokshana, Virechana and Basti, after that there is a phase of maintenance of the disease or taking care of the overall inflammation and the joint condition and the pain relief. For that, there are various herbal and herbomineral medicine which has to be consumed for a certain time. Apart from that, there has to be a strict diet regime to take care of these joint disorders, because inflammation most of the times happens because of the wrong dietary habits. And these wrong dietary things, one example I can give you, that excess spicy food, excess pungent food, excess sour food will increase the inflammation. In Ayurveda, it has been written that excess eating of buttermilk or excess eating of curd will also increase the inflammation of the body, and which will complicate these inflammatory joint disorders like rheumatoid arthritis or gouty arthritis or any kind of reactive arthritis. So in these conditions, we have to do a proper diet regime, and that has to be followed for a certain time. After that, there is a role of yogasana or specific exercises. Now, these exercises cannot be generalized. In most of the inflammatory conditions, there is no role of exercise in the initial part until and unless the joints are, inflammation of the joint has reduced. Because many times when there are wounds inside the synovial membrane, these wounds gets rubbed because of the excess movement and the vigorous exercises, and that gets complicated again and the pain aggravates. That is why exercise or yoga has to be done completely under the guidance whichever are really recommended. Apart from this, the most importantly, the lifestyle, and at what time one should get up, at what time one should eat the food, at what time sleep has to be completed. All these things has to be done properly. Once we do take care of all these factors like detoxification, medicines, proper diet and lifestyle and exercise, then the joint disorders, may it be a degenerative joint disorder or inflammatory kind of joint disorder, can be taken care very properly. There are restrictions or there are limitations to treat the joint disorders with Ayurveda. I mean, the degenerative joint disorders of grade more than the grade 3 or grade 4 cannot be reversed. In those cases, we just have to maintain that condition, and we can just take care a certain amount of pain in those cases, because these cases have to be treated only with the surgical interventions. In inflammatory joint conditions, the severity, when the severity is too much and patient has to take steroids and there is no other option to take care of the pain, only in those conditions Ayurveda has limitations. But in the less severe cases, even if the patient is on steroids, we can reduce the dosage of the steroid, we can stop the dosage of the steroids, we can stop the hydrochloroquine, we can stop the methotrexate of these patients very systematically, and this is done very scientifically. I'm not saying all these things just on the basis of my experience, but this is also written in the classics of the Ayurveda, as well as this can be proven with the cases we have treated so far and their reports. This is how I can say that Ayurveda has a lot to do in terms of taking care and the management of the joint disorders. I would say that let us not land into the condition where you have to get the surgery done. Before that, in the beginning stage itself, you should go to the Ayurvedic hospital and the Ayurvedic doctor to take care of these kind of joint disorders. At the same time, it is also important to take care of our joints as a primary as a preventive care, because we have seen that because of the occupation, many of the patient has to stand for a longer time. Many of the people, for example, people who are working in the kitchen, they have to stand in a slanting position for hours together, and because of that, the knee joint as well as the back lumbar spine gets hurt and gets degenerated. In cases of degenerative joint disorders, we have to focus more on nourishment part of the joint, where we have to do various external therapies like Janu Basti, like Kati Basti, Griva Basti. These local bastis are nothing but the oil pooling on that particular part. For example, if we are doing the Janu Basti, we have to do the oil pooling of the knee joint. So this is for increasing the lubrication of the joint at a larger amount. At the same time, that also nourishes the synovial fluid and the synovial membrane. But this has to be done only when there is no inflammation and inflammatory part has been taken care with the medicines as well as the other therapies. Apart from that, we have to do the Navarakiri, that is rice potli massage, which is dipped. The cooked rice is tied in a cloth and a bundle is made, which is dipped in the medicated milk, and that is rubbed on the joints to do the nourishment of the joints. Likewise, we can do with the help of the various grains, especially like black gram, as well as in some cases we can also do this with the help of the flesh. So these external therapies helps a lot to take care of the nourishment of the joint, and that helps taking care of the degeneration of the soft tissues. Apart from that, oil enema, that is Anuvasana Basti, has an important role in this. And when we do this in combination, so that really relieves pain and restricts the degeneration of the joint. The work is inevitable and we have to do that. In that cases, we also have to take care of that. There are simple techniques of taking care of that as per Ayurveda. I mean, just doing a regularly oiling of the joints also helps a lot to nourish that and not to get degenerated. There are so many such things can be done even at home. My sincere suggestion to everyone is prefer Ayurveda, yoga to take care of your joint health. Thank you so much.